This Focus on Health segment is brought to you by Aurora Healthcare.
Hello and welcome to Focus on Health. I'm Ted Stefaniak. Today we're at the Aurora Health Center in Oshkosh, and we're going to be speaking with Dr. Scott Johnson. He's a pediatrician who is going to be talking about adolescent immunizations. Well, thank you very much for joining us today. You know, people sometimes get confused, when they have children, the little ones have to get immunizations, but when they get a little bit older, 6th grade, so on, that's when they've got to get booster shots and things. Tell us a little bit about why it's important at 6th grade.
Yep, it's important at 6th grade to get boosters. Primarily, the one that we're seeing the most right now is whooping cough. Whooping cough's kind of prevalent in Wisconsin. Us in California are the states that have the two highest levels of whooping cough, and that's the reason for that is that whooping cough wears off, so you need to be re-immunized every 10 years or so. And so at 6th grade we give diphtheria, tetanus, pertussis, so that's whooping cough and tetanus. Tetanus is in dirt, and so we're exposed to that all the time, especially kids when they're playing outside. We also now recommend a meningitis vaccine. That is a vaccine for an infection in the layer of brains. It's really fast acting. It attacks people that live in close quarters. So usually it's the high school kids, but also college kids. And that one's a 2-shot series now where we do it at 6th grade and then when they're 16. Okay. And so it's important to get in and be seen with those. And then the third vaccine that we do now is HPV vaccine, human papillomavirus.
Sure.
It was initially marketed as a cervical cancer vaccine, so first it came out with girls, that we should do it with girls only because they're the only ones that have cervixes. And it's important to get that one started before kids have sexual activity.
Mm-hmm. And now the recommendation is also possibly for boys?
Yeah, that's recommended for boys to have it for a couple of reasons. One, boys are the ones that carry it. Generally, they don't get sick with it, but they're the ones that pass it to girls, and that's how girls get it in their cervix. But we're finding out in the last year that HPV causes about half of the mouth and throat cancers, which that number is going to rise because less people are chewing tobacco and smoking. And so it's an easy way to prevent cancer both in boys and girls.
And again, you're looking at that around 6th grade?
Yeah, it's important to do it before sexual activity, and so that's sometimes a hard topic for parents to think about with their kids. And most, if not all, 6th graders are not sexually active, but you never know when that's going to start. And so we usually do it with the 6th grade vaccines because we're already doing vaccines. The hard part with kids for that one is it's a 3-shot series. So you get one the first day you're here, and then you get one 2 months later, and then one 4 months later. Wow. So it's a little harder sell for a couple of reasons. A, the topic's uncomfortable for a lot of parents, but B, it's not one shot.
Sure.
So a lot of kids don't like that part of it.
And what about hepatitis A? Is that important at this age?
Yeah, there's hepatitis A is a liver disease. It's called, we've been vaccinated for hepatitis B 20 years. So pretty much all the kids have done it. Most adults have had hepatitis B now. Hepatitis A is not as severe as a disease, but it's more common in certain areas. So it's common in the Southwest, so dry areas that are warm. And with the amount of travel that we're having now that people do, and who knows where kids are going to end up with college or working, it's recommended that they get it. So we're doing all babies now, and now we're starting to catch up older kids. And so that would be a 4th shot at 6th grade. And so it's not recommended that they get it at 6th grade. It's recommended that they get it before they're done with high school, because once they're done with high school, who knows where they're going to go.
Yeah, so. And I don't know too many people that enjoy getting vaccinations, getting the shots, and you're talking about up to 4 for 6th grade right now. Is it safe to get all 4 at once, or do you have to spread them out a little bit?
Nope, it's very safe, and that's a topic that's been studied a lot. There are more vaccines now than when we were kids. When I was a kid, we had oral polio, we had MMR, and we had diphtheria, tetanus, pertussis. And over my lifetime as a kid, we got injected with 440 different things. And now even with so many more vaccines, people are injected with about 250 different things. So it's way less than it used to be because the vaccines are more pure. But compared to what we breathe in our nose and what we eat daily, it's a minuscule amount. So really the only problem with 4 shots is it's 4 shots. 4 shots.
So. Just suck it up, I guess.
Right.
It's important to have those.
And realistically, we're not opposed to splitting them, you know, so like doing 2 when kids are 11, and then when they come back in for their 12-year physical, to do 2 then as well. You know, there's not anything medically that says they all have to be done there. The only one that has to be done when they're 11 is a diphtheria, tetanus, pertussis, because the state requires it to get into 6th grade.
Okay. And then after that 6th grade range, when you start getting to be a teenager and you're in high school, how important is it for the flu shot given the flu season?
It's very important, and that one's semi-controversial also because teenagers, high schools, they get the least sick from the flu because of their age. But also, they're the ones that are exposed to the most amount of people, you know, because they have their classmates, they have their friends, they have parents, grandparents, and everyone. So it's important to stop the spread of disease, which is a little different than stopping the disease in the person. Sure. And the good part of that is there's a nose spray now. So you don't have to get a shot. You can come in and get a nose spray. Right. That's what I've done the last 3 years.
Right. And lastly, I wanted to just touch upon cholesterol screening. And is that important for kids?
Yes. There is a new recommendation that all kids before they leave home, so usually 18, that they get screened for cholesterol level at least once. Mainly to make sure that A, there's not a problem, but B, so that we can say, okay, when you were 11 years old or 12 or 15 or 9, your level is normal, now you're 25, it's not, so let's work with it. So it's not, again, necessarily something that's going to benefit you right then, but it'll benefit you down the line.
Okay.
And if there's a problem, we can fix it, obviously.
Right. And we've covered a lot of vaccinations and some different recommendations. If people have questions about that, how can we get a hold of you?
Yep. Easiest way is to call our clinic here, 303-8700. And really the easiest way is to schedule an appointment with your doctor and bring in. A lot of adolescents, teenagers don't like coming to the doctor, and we don't see them at all. So it's important to come in, if not every year, at least every other year.
If you have any questions about adolescent immunizations or any other pediatric questions, you can get a hold of Dr. Scott Johnson or anyone else in the pediatric department by calling 920-303-8700. I'm Ted Stefaniak, and we'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.